Well, have you ever heard of celiac disease? Many of you probably answered that question with a resounding no. And though many of us are unaware of the causes and effects of celiac disease, I'll tell you what, 3 million Americans are at risk of being diagnosed with it, and millions more remain undiagnosed because of a lack of knowledge. Well, we want to improve your understanding of this affliction this morning and help keep you, our viewers, healthy. That's our mission here at The Balancing Act. And so joining us this morning as part of our My Health series are Dr. Matthew Bromer and Phyllis Kessler, president of the Celiac Disease Foundation's Florida chapter. Welcome to the show.
Thank you.
I'm so glad you're here because, Dr. Bromer, I want to begin with you. A lot of people have not heard of celiac disease. What is it exactly?
Well, 1 in 100 people actually have celiac disease, so it's quite common. It's those people who are genetically susceptible when they ingest something called gluten, which is in many common foods, breads, pastas, among other things. Their body forms an immune response and actually damages their small intestine, which is used to absorb nutrients and minerals. That can lead to a variety of different symptoms in some people, such as diarrhea, weight loss, bloating, which are common symptoms. But most people that we see actually have no symptoms at all.
You know, I think that's interesting because you talk about the symptoms, and those symptoms sound like they could be something else, right? Not celiac. Is that why it remains so undiagnosed?
Yeah, a lot of people come to see doctors because they have bloating or gas, especially as a gastroenterologist.
Right.
Those symptoms can be like irritable bowel syndrome, like lactose intolerance, and unless someone actually thinks about the disease, they're not actually going to test and try to make the diagnosis. And a lot of people also go to other doctors, such as a hematologist or rheumatologist, for other problems, such as iron deficiency, anemia, and those actually might be secondary causes of celiac disease.
You know, and I think that's interesting because you and I were talking a little bit off camera, Phyllis, about the fact that you remained undiagnosed for many, many, many years. And now I know that you're president of the Celiac Disease Foundation Florida chapter, CDF. What exactly is the mission of the organization?
Our goal is, and we have been doing this for over 20 years, is to raise awareness of celiac disease, to help people navigate the road to the gluten-free diet, get the proper diagnosis, answer questions, be there for support, and educate doctors as well.
And I think that's one of the most important things. What are some of the programs that CDF offers for people who do have this disease?
Eating gluten-free can be rather expensive. The foods are rather costly. So we created a program called the Food Assistance Program. If you fall under the poverty guidelines set by the federal government, CDF actually will give you some money towards your grocery bills. We also do free community-wide blood screening for people who don't have insurance to determine whether or not they have celiac disease. Of course, a blood step is the first step to check your antibodies. The gold standard, though, is the endoscopy. We have expos to introduce products from all over the world. And gluten can be found in more than just food, and I think that's one of the goals of CDF.
That's what I think is interesting. Yeah, it's not just, which is what I would think.
Yes, it's medications, it's makeup, it's hand lotions, but primarily it's the foods we eat. It's the gluten that's found in the food.
You know, and the other thing, doctor, that I find interesting is that with celiac disease, it could range, you know, from what, age 2 on up to, I know you said one of your patients who is newly diagnosed is 89 years old?
It was an older gentleman with osteoporosis who we just did an endoscopy for another reason, and sure enough, he had celiac all along.
Absolutely amazing. How can people find out? You know, how can they find out if they have celiac disease, and how do they know if they're being misdiagnosed?
Well, one of the big problems, again, is just thinking about the disease and educating not only people, but also physicians to think about those. If you have symptoms that you can't explain, it could be simple things like migraine headaches, even depression, or if you're diagnosed with osteoporosis, as many women are, ask your doctor about it. They do a blood test, which is simple. Then you can actually get treated, and maybe some of these things will actually get better and go away.
Wonderful. Well, good advice. I'm so glad you're here with us this morning because I know a lot of viewers appreciate the information that you've given them today. So thank you.
My pleasure.
Thank you.
All right. And if you'd like more information about celiac disease or the Celiac Disease Foundation, simply go to their website at celiac.org.